Welcome to Pull Up with Limbs and Things. It's August 2023, and I am your host and guest tonight. I want to tell you a little bit about what someone has been asking me about exercising, the things that are important as you are aging, what I see from my perspective and seeing people in their home environments. Limbs and Things, Pull Up with Limbs and Things is to confirm something you know, challenge something you don't know, and to give you an opportunity to share that information with someone else. If you're watching this live, please hashtag live. If you are catching this on the replay, hashtag replay. So, I became a physical therapist because my whole goal was I wanted to see somebody go from whatever they couldn't do to really being able to do it. And I saw from all the different settings that I observed or that I worked in, that was most achieved in home health settings. So I'm not necessarily a home health therapist, but in being a mobile provider, we see people after home health episodes are over, and the goal is to really maintain someone's independence in their home environment. A lot of times, the people that I'm seeing are um, having caregivers in their home, or their caregiver is a family member. And the way that the person is aging is causing some more changes for the caregiver to have to do a little more. And so, if I can get a person to being able to be as independent as possible, that's my goal. So, one of the ways that we do that is just teaching people how to avoid needing a physical therapist. One of the ways is making sure that that person knows from a safety aspect what's really important. If their home has a lot of throw rugs, if you've got low lighting, if you have chairs that are mostly rolling chairs, chairs that are mostly ones that don't have arms in them, that makes it a little bit harder as you're aging. And so, one of the things that we do when we come for assessments is just assessing your environment. It's not to talk bad about how your house looks, it's not to assess how things are laid out in your home. However, it is a way to assess your function in your current environment. And so, if some of those things occur, it's really just to help you be as independent as possible. So, um, a tip is to make sure that you are having all of the devices that you need. So if you need a shower chair, if you need a stair lift, if you need any of those things to help you, even if you need just double-sided tape to ensure that those throw runs that you love so much are staying down so that they're not causing a trip hazard. We look at the outside, we look at the inside. If the person has steps, but you are unable to do the steps, then that's a factor we consider. And we talk about ways that perhaps a modification might be helpful and some of the resources that are available in DC and Maryland and Virginia to help make that less of a financial burden. Okay, so three things that are highly important is avoiding being in the hospital. That's a way to avoid needing a physical therapist. And so you want to avoid getting in the hospital because they are more than likely going to keep you for a little while as you get older. We just want to make sure that you'll be super safe when you leave. And so hospitals may keep you, depending on how old you are and then what's really going on with you, especially if you're admitted versus just being sent to the ER. And then, so hospitalizations, we try real hard to avoid those unless they're dire needs for a medical emergency. All right, that's the first one. And then you got to stand. You got to limit how much you are sitting because weight bearing, joints, muscles, bones, they all like to have a little weight on them. Bones require muscles to pull on them in order for them to be strong. And as we get older, we know that our bone density decreases, but also the strength of our bones if we are not maintaining that weight bearing process on them. So even your upper bodies, if you're pushing, if you're standing, if you're pushing up against the wall, all of those things help to improve the strength of your bones, which is highly important because if you fall, a way that you can go to the hospital is because you've broken a bone. So you want to make sure that you are doing what you can to have strong bones and muscles. Okay, so standing. A good thing one of my patients has started to do, she told me that and this exercise that we do, or an assessment, it's called the 5-time sit to stand test. She does it every time she comes from the bathroom. Now, I do not recommend that you do this before you use it. Make sure you're on the way out of the bathroom because we don't want you to have any accidents on your way to the bathroom. So make sure that this is on the back end when you're headed out, that before you are coming up from the toilet, you sit back down. You come up and you sit back down. You do that 5 times. We're looking at speed as a physical therapist because that tells us how strong your muscles are, and it also tells us how well your balance is too. Now, for those of us who are physical therapists, we put them into different categories, and it's based on your age, how well you are doing for your muscle strength. So that's something you can look up online if you're a Google fan, and you can see the ranges of what it should be based on your age. Now, I see people, my youngest patient right now is 59 and my oldest is 99. The people that are over 90 do not have a normative value. For some reason, they did not do normative values for people over 90 years old. So for you, you should use that in range, the 80 to 89-year-olds, in determining how strong or how well your balance is if you use that 5 times sit to stand test. Okay, so we want to avoid hospitalizations. We want to stand more, and we want to make sure we're pushing more. So if you do a wall push up, if you can get down on the floor and do a real push up, if you can push yourself up from your chair, all of those things are ways to put weight on your upper body, but also standing, walking, jumping even. Don't think just because you're old that you cannot jump or that you cannot run. You can skip any of those things. That helps you. Because if you see a bug or you see something quick and you go to jump, you want to make sure you can do that because we don't want to have any issues where you go to do those movements and then you end up falling down. Okay, so limiting our hospitalizations, limiting how often or how long we sit. So standing more, bearing more weight on our joints, upper and lower body. But then we also need to make sure that we're incorporating functional movements into our daily lives. So whether you go reach for a pot or pan or something, if you're still cooking, if you are opening and closing the door, if you're going to get the mail, if it's not at your porch, but it's at the street, you want to make sure that you have the functional ability to do that. And maybe you don't just do it once a day, you go a couple of times since you have a little time. Those of us that are still cutting grass, those of us that are still knitting and sewing, doing all those fine motor activities, and being able to go and come as we want, we just want to make sure that you are limiting how much you are sitting, and then making sure that you're doing those functional activities, all of those things, as often as you can. And then the socialization aspect, that's so important, but so under talked about. We tend to think that as we get older, our friends, some people are passing away, some are no longer in an area that we can go out and socialize with them. We get to the point where we just, I don't want to be out with anybody. But being on the phone is important. It helps to have a sense of connectivity with someone. It helps you cognitively, just in listening and trying to remember what someone is telling you, not just, what's the weather or some of the other things that people talk about in random conversations, but knowing how well a person is doing, their family members, um, situations that they brought up to you before. Those types of things help improve your memory. And so you want to make sure that you are having that social connection with someone else. All right. And another thing that tends to be under talked about or not talked about enough is in older adults how important it is for shoe choice, as well as keeping our skin as flexible and pliable as possible. Whether you have had an injury, and you've had, say, a replacement, and you've got to incisional line that you are trying to reduce the adhesions up under the scar. You just want to make sure that you are lubricating your joints. Your skin is your largest organ in your body, but it's covering all your joints. So if it's cracked, if it's dry, it's going to make it even more difficult for you to move it. And so you want to make sure that you're doing all that you can to keep your outside of your body as lubricated as possible. I like to liken how flexible someone is based on like a car, especially as we get older. I have had my car since high school. So that was '05 to 2023. And it is so important that you have constant turn it on and that you are constantly driving it or it's just going to rot. And so it is so important that we treat our bodies similarly. We got to constantly move it so it stays like a well-oiled machine. And so it's very important that you lubricate the outside of your skin and you move your joints. It's really important that you keep that flexibility and it improves your reaction time. Safety, being an older adult, is really important. No one wants to look vulnerable, especially even if you're going to your porch. I had one patient that told me one time, she said, I don't want to go out of my house or practice anything outside because I don't want to appear vulnerable to someone who is looking, or knowing that I live here by myself and that I need to be a target for them. And so you just want to be cognizant of those are the types of things that can happen to aging adults in their thought process and ways and reasons that they don't want to do things. But as long as you are doing the things we talked about, you'll be better able to come in and out of your place to reduce the chances of appearing vulnerable to someone and giving yourself the best chance of being as independent as possible. If you have any questions, you find this information helpful, do us a favor and share it with someone else. It's so important that we make sure that people know as much as they can so that they can age well. All right. So, hope you've enjoyed this pull up with Limbs and Things. Limbs and Things is always available to help you move from I can't to I can. You can find us online at limbsandthings.com. You can send us an email at limbsandthings@gmail.com. And you can also call us at 202-643-2636. Have a wonderful rest of August. Take care.